Today we're talking about sinus problems, something many people deal with year-round. And joining us is ear, nose, and throat surgeon Dr. Cole Rodman from ProLiant Surgeons Puget Sound ENT. Dr. Rodman, thank you so much for being here.
Thank you so much for having me.
Okay, so let's start with the basics. Why do people struggle so much with sinus issues?
Yeah, so I like to think of two main reasons that people struggle with sinus issues. There's mechanical or structural reasons, and then there's inflammatory reasons. Mechanical issues are like the septum that divides the left and the right wall, or the left and the right sides of the nose being crooked. That can block one side of the nose or the other. Also, sometimes the sinuses, which are air-filled cells in the nose itself, can be developed in a way that blocks the flow of the mucus out of the nose. So that's kind of the mechanical reason. The inflammation reason is stuff like allergies or recurrent sinus infections. So those are kind of the two main reasons that people tend to have sinus problems.
Well, it makes sense, I guess, that a lot of us then have those problems. And so many really try and just manage it themselves at home, but what are some treatments that actually work and help?
Yeah, absolutely. So when a lot of people come in to see us, we start them with two of the tried and true treatments. So the first thing that we often recommend is something called a nasal saline rinse or a saltwater rinse. That's using a bottle like this right here.
Oh.
What you do is you use distilled water or water that you boil and then, of course, let cool down.
Okay, good. Yeah, give me those tips.
And then put a little bit of salt in there. It comes with a salt packet. That makes sure that the water doesn't hurt when you rinse it through your nose. That helps do the job of cleaning off the lining of the nose, cleaning out those allergens and things that inflame the nose.
Okay.
The second thing that we often recommend people try is something called Flonase or fluticasone. That's the second bottle here. That's a nasal steroid. And so it's a very low concentration, very safe medication. Use it once or twice a day, 2 sprays in each nostril. And that slowly builds up in the lining of the nose over the course of about 2 weeks. And then reduces the inflammation. So it just kind of serves to turn down the thermostat a little bit on the nose. Makes a little bit more space in the nose, decreases a runny nose. And so those are kind of the two big things that we recommend.
When should someone go and see y'all, though, and see a doctor?
Yeah, absolutely. So the main reasons to come see us, again, get back to those two reasons people have sinus problems: inflammation or mechanical problems. So if you can't breathe through your nose, if you're having a lot of stuffiness in your nose, if you feel like you're getting a lot of congestion, that's a great reason to come see us. That tends to be a more mechanical problem or structural problem. And then if you're having a lot of inflammatory symptoms, so things like a really runny nose, if you're having a lot of sinus pain and pressure, or if you're having recurrent sinus infections. So more than 3 or 4 sinus infections in a year that you're taking antibiotics for, that's definitely a time to come see an ENT.
Okay, and then for people that need more than home care too, surgery, what does that look like today?
Yeah, absolutely. So this is a question I get all the time from my patients, and I always joke that I feel like there's been a lot of intergenerational trauma about sinus surgery.
Yes.
Almost everybody knows somebody who had surgery 20, 30 years ago, and they had all that packing in their nose, and it was miserable. I'm happy to say we don't do that anymore. The recovery process tends to be quite a bit better. It's all done minimally invasive, so with cameras and instruments that go through the nose, no cuts on the outside, and our general goals have changed a little bit too. Now we want to do as little as possible to get the best benefit. Surgery tends to be a mechanical solution, meaning that we want to just fix the structure of the nose so that it works a little better. If that's straightening the septum, or just opening up the sinuses so that they drain better, or so that the medications can get in there easier. So that means that these days people's recovery tends to be about 1 week off work and a stuffy nose for 2 to 4 weeks afterwards. Still a surgery, but much, much easier than it used to be.
Okay, well, that's good news for everyone watching at home. And does the surgery itself take a long time too? I know you said the recovery is 1 week maybe from work.
It's about 2 to 3 hours depending on the surgery, which for us is not too long. And outpatient, go home the same day. And most people are feeling pretty good by the time the anesthesia wears off. So they're able to go about their daily lives, just, a little bit of pain and tenderness in the nose, and again, some stuffiness. So.
Okay, well, you don't have to be too scared then for everyone at home. I get a little nervous. Before we wrap up today too, please tell us a little bit more about the practice and, of course, where people can find you.
Absolutely. So we have offices in Edmonds, in Mill Creek, and then downtown in Seattle. We really pride ourselves on trying to have availability for our patients, oftentimes within a day or two for appointments. Occasionally, we're able to get people in same day, which is excellent, and we really are, again, try to maintain that in our practice. We do have also same-day surgery, or I'm sorry, surgery centers at each of our offices. So. Yeah.
Wow, that's like unheard of now that you can get in. So thank you so much. We really appreciate you being here. This was very interesting. And for more information about ProLiance ENT, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by ProLiance Surgeons Puget Sound ENT.